Hello viewer, welcome to Chungu cha Jamii. I'm your host Eunice Mugo. Today on the show we are talking about breast cancer and we are looking beyond awareness and we are asking how society can protect and support women with breast cancer. Are you a woman? Are you suffering or having breast cancer issues? What are you doing to take care of yourself? What are the people around you doing to support you? Send in your question, interact with us across all our social media networks. That's GBS TV Africa. Our SMS line is 21144. I'm not alone. I have a guest with me who is going to help us to understand better how to go about beyond awareness in breast cancer. I will allow her to introduce herself. Welcome, guest.
Good morning. My name is Dr. Annah Manyega. I'm a medical officer at Equity Afya Lucky Summer. I'm very glad to be here today to talk about such an important topic that not only affects individual women, but also families and even entire communities.
Thank you so much for honoring our invite and also coming. Viewer, as you all know, that October is the Breast Cancer Awareness Month, hence why we are having the conversation on breast cancer. Here at Chungu, we value ourselves as a people who look out on issues that are affecting the society. And cancer being one of the issues that is affecting the society, more so breast cancer affecting women who are one of the greatest pillars in our society today and in our community at large, hence why the conversation today. So maybe to start with, when we are talking about beyond awareness and also how the society or the community should take care of women suffering from breast cancer. What is the first thing that comes to your mind as a medical practitioner when you want to educate the community about breast cancer? What is the first thing that comes to your mind?
When it comes to breast cancer, generally, we want our women to know what it actually entails. We want our women to be empowered with knowledge on what exactly is breast cancer, because we know in our society, cancer is quite a new disease. It was not a disease of the past. So we want them to actually understand what it is. Beyond that, we want our women to know what puts you at risk of getting breast cancer. How can you know it is breast cancer? How do you detect early? And even when you have suspicion, what actions are you supposed to take? And after that, what does treatment look like for you? And even after treatment, how are you going to live after the diagnosis? If you survive, how are you going to live beyond that? How will life look like? So that is generally the scope of what I think about when it comes to breast cancer.
Interesting. Maybe before we dwell so much into the depth of the concept of today's topic, what would you say is the biggest misconception when it comes to breast cancer in our society today?
The biggest misconception is that breast cancer is not curable.
Okay.
Yeah. Most people think that cancer is a death sentence, but in actual sense, there are many people who have survived breast cancer and even other cancers. So when we overcome that, this will change the narrative completely, because breast cancer is not a death sentence. That's why we are saying early detection saves lives. When breast cancer is detected early, stage 1 or the pre-invasive cancer, it can easily be treated and a woman can go back to being her normal life. It is curable. Yeah. But the important thing is early detection, because that is what improves the survival rate and that is what also improves the treatment outcomes.
Interesting. So how can we shift the public conversation so that we don't have the fear or the stigmatization when it comes to going for the screening and even for the test, so that by the end of the day we have hope and support? Because I also look at it from the perspective of what are we looking out for exactly? Because if I have a flu or a cold, I'll cough, I'll have irritation of the throat. If I'm having chest issues, I'll start feeling pain. So when, at what point now do you say, because honestly, talking on behalf of everyone else, please agree with me, even for you as a doctor, you just can't wake up one day and say, I'm just going for breast cancer screening. How do you even start that?
Yeah, we know that breast is a sensitive issue when it comes to both women and men.
Okay.
Because for a woman, a breast entirely determines your cosmetic outlook. So breast is a very sensitive issue. But now when we know what we look out for, then it increases it encourages you to go to the hospital. So that's why we, as healthcare workers and even as a doctor, we encourage women to know how to do the self-screening at home, so that when you know something is suspicious, you can go to the hospital. So what I mean exactly is just stand in the mirror, do this every month. It's very easy. It's not as complicated as you think or other people think.
You can show us, please?
Yeah, it's very easy. So every month, stand in front of a mirror. Don't do it before your period or during your period. Do it around a week after your period. Because before and during the period, the breast is very tender. Sometimes you have lumps because of hormonal changes. So you might get a false alarm and run to the hospital thinking it's actually a lump. So wait for the period to be over. The week after now, when the breast is not painful or tender, do the self-examination yourself. So just stand in front of a mirror. Obviously, you have exposed your breasts. Just stand, look at them. How do they look? Normal. Are they the same in size? Obviously, size disparity is normal, a little disparity. But when the disparity is too big, the size is significantly different from the other. That's something to watch out for. Then look at the skin of the breasts. Is it normal skin or is there dimpling?
What do you mean by dimpling?
You see the way the orange skin looks like. We call it pure orange. That's the dimpling. The orange skin, the way it has dimples.
Orange as a fruit?
Like the fruit itself, the way it has to dimples. Yes, so when something suspicious is going on in the breast, like breast cancer, usually you have those minor skin changes. So instead of normal skin, you'll see those dimpling, or just the skin looks like it's being retracted from the inside. And then on top of that, look at the nipple. How does the nipple look like? The normal nipple is just, it protrudes towards the outside. But when you have breast disease, the nipple will be inverted. It will go inside. And obviously that's abnormal. Then on top of that, squeeze the nipple itself. If you're not breastfeeding, there should be nothing coming out. So is there any discharge? And what is suspicious is the bloody discharge or blood-stained discharge from the nipple. That's also something to look out for. So on top of that, just raise your hand, and then you can do the palpation yourself. Palpation is just feeling the breast. Use the palm of your hand, and then go in a clockwise or anti-clockwise manner. From outside, you go palpating, 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 round. That's a very good way to know. And then don't stop there. Go to the armpit. So you also do the armpit because the armpit has lymph nodes where the breast drain. So if you have breast cancer, the first place it will spread is the lymph nodes of the armpit. So also do that for the armpit. Touch. Do you feel any masses, any swelling?
Even when you're feeling the pains there, they are normal, and especially. What are you telling me? So anytime I feel abnormal in my armpits, it's a cause of alarm? No, really. When I'm in pain, is it a cause of alarm?
Not really. What I'm saying is that feel for any abnormal lumps.
Oh, so for the armpits, we're looking out for the lumps.
Yes, same for the breast, we're also looking out for lumps. Yes. So if there's a suspicious lump, then rush to the hospital. So now that you are doing monthly self-examination, to the hospital you should go at least 1 to 3 years, but 1 year is the safe point. Just go to the hospital to get a clinical exam where the healthcare practitioner is the one doing the examination for you, regardless of how the self-exam was. So the healthcare practitioner will also do the breast exam for you, and will tell you it's okay or it's not okay. Just take yourself once a year. Then even beyond that, now when you turn 40, you know, with age now your risk even increases more. So women 40 years and above are the ones who actually, the diagnosis mostly is done at that age. So in case you've turned 40, now on top of the clinical exam now, we'll send you for what we call a mammogram. A mammogram is the X-ray of the breast tissue. So once you turn 40, just come to the hospital. You get at least once a year, you get the mammogram.
But once a year?
Yeah.
But the X-ray is going to expose me more. That's the sense or the common sense I have from the rays. You're told you're not supposed to expose yourself through the rays of the machine oftenly.
Yeah. Yeah, there's that risk also. But sometimes also when the benefit outweighs the risk, then actually for women who, if you have relatives, first-degree relatives, like maybe your mother or your sister had breast cancer, for you we'll do mammograms from 25 years of age every year.
In as much as you're saying the risk is outdoing the
benefit is outweighing the risk.
Are you not exposing that person to more risks when she's going through the X-rays?
Yeah, you know, with X-rays,
especially when you say the first-degree relative has breast cancer, then for example, if I'm the one and then you expose me from as early as 25 years of age, and I've been doing that year in, year out, am I not more likely now to get because of the exposure of the rays compared to the risk factor because my first-degree relatives have the cancer?
Not the radiation from the X-ray, the risk is not that significant. What actually causes more significant risk is, you've heard of radiotherapy, where they actually get the rays for treatment. That one is significant exposure, but the one for X-ray, the duration is very little, so the risk is very minimal. If you compare that very minimal risk to now actually getting breast cancer, you can't compare.
Okay.
Yes.
That one makes a lot of sense. Now, when you talk about, now we've really looked at the fear and also the stigma.
Yeah.
What is the ripple effect after knowing, now given that you're a medical practitioner, dealing with women, because even before we went on air, we were discussing it and you're saying, what are the challenges that women face when they are diagnosed with the breast cancer? Let us look at it from two different angles. For a single mother who has no spouse, but maybe has family and support love from people around her, and a married woman who has a husband and also a family to support. And maybe the third one who is either single or married, but doesn't have support per se. What are the challenges that these three different women are likely to face when they are diagnosed with breast cancer?
So for our first scenario, like a single woman who doesn't really have the financial support that she needs, even from the spouse and family, it's very challenging, because once you get a breast cancer diagnosis, treatment, we are looking at 3 modalities: radiotherapy, you have chemotherapy, all of that, and then we have even breast surgery. So for this woman, you can imagine all of that. Maybe she needs to go and get the mastectomy. Mastectomy is where they remove either part or all of the breasts. So for her to access those services. And given in Kenya, we have very few facilities that are providing those. We have Mpisha, we have Aga Khan, the big private facilities they offer. But the for the public facilities like Kenyatta, even for her to be able to avail herself for that surgery, you can see how hard it is. Then you have chemotherapy. This patient has to go, it's not usually one cycle, you have to go for repeated cycles. And even when you're going for the repeated cycles, you are suffering immense side effects from the chemo: hair loss, vomiting, nausea, weight loss, emotional derangement. So you can imagine this woman, on top of the financial burden, she's not having anyone to support her emotionally through the treatment process. So you can see that it's a lot. So this woman is going to face a lot. After that, she still will need, let's say, to get breast reconstruction. I've already said very few facilities will offer that. Does she have the finances for that? Will she be able to leave her activities behind, her family? Because let's say she has a child, so that she can go for the surgery on top of the treatment. So you can see there's a lot that goes into it. Second scenario, maybe you're married, you have children. Yes, you have the spousal support and the family support. Your spouse, does he truly understand what is going on in terms of your diagnosis? Because this is something that is very unfamiliar to men. So he also has to understand what is going on so that he can also be there for you. Yes, because obviously things cannot be as usual at home. Your breast is sick. So
I have a question before this evaporates in my mind. Of late, we've been having the challenge, most on social media. I've seen it before. Women are really coming out very boldly to make sure men understand what exactly we go through. So we started with the pregnancy test, where men really thought women are just being lazy during the pregnancy period and they can't do anything. And they think, by the way, unajifanya. For lack of better word, right?
Yeah.
So for this challenge, women have come out giving men watermelon and wrapping them around their belly and helping them move around the whole day. It's really challenging and tedious for men because they're not used to. But then you can't even compare, sorry to say, kitambi and pregnancy. They are two different things, right?
The same.
Of late, I've seen the challenge of menstrual cramps and the pain and the discomfort. But I think they have those two shock absorbers, the stimulators. And when you see through those the challenges that they're having on social media, you can hear men scream for the stimulation. We go up to 10, then they're given 2, 3, 4, and you're like, I can't stand it. And that's just the menstrual cycle and the cramps and the discomfort here and there. And we have it depending with your days, whether 3 days, 4, 5. The extreme goes a week or 2, right? Now, do we have such when it comes now to breast cancer? Because that's the thing that has come to my mind. You say your man has to understand exactly what you're going through. Do we have such things that can expose men to such, so that by the end of the day, even then they have their prostate, they'll ask, do you have any for us to understand? But I think women, we are very emotional, we get to understand very fast.
Yes.
But do we have such? I'd really want to know, but I'm being told first you have to take a break. So when we come back, you tell us, please, do we have such? And if we do, how often and willing are they to go through that? Because if I feel like if they really get to understand from that perspective, maybe it's easy for them. Because for those who have been exposed to the stimulant, for now I'm sure they're really taking care of their women during that time. Because you get to do everything. You don't get to choose to be a woman, you just find yourself to be one.
Yeah, right? And you have to cope with it.
I'm looking forward to that answer. Viewer, I hope you're learning as much as I am. Send in your question, interact with us across all our social media networks. That's GBS TV Africa. Our SMS line is 21144. We'll be back shortly. About being a pageant queen. It is not just about wearing a crown or looking pretty on social media. It is about how much you can impact the community. What can you do with the title you hold? I'm actually a young model in the industry. I started modeling this year in school. Actually, I used to go to International Youth Fellowship where we had a modeling class. I used to study fashion and design, and we had a modeling class. So I am high fashion trained. On Instagram, kelly.omuhaya. On TikTok, Miss Omuhaya.
Now tell us about that moment when you had your name that you won Miss Kasarani 2025-2026.
What I would like to advise you is keep going. Keep going. Put God first. Be resilient. Be a go-getter. Find joy within yourself. Walk with pride. Chin up. Smile. You are a queen. He who is in you is greater than he who is in the world. That makes me always rise, knowing that I have something that is greater than what people can see.
SK the DJ Ava, aka the Mix Wizard.
Don't call me MC Slingshot. If the flag don't pick up, I'ma lose it. All I need is grass, meaning boozy. I'm worried about Jada Juicy. Yeah. Boozy. Comparing me to these rappers, nika kunitusi. Wale dani masa ni cheesy akiosha mbuzi.
Mbuzi in this reference inamaanisha nini? Oh, you're the god!
Ndio.
Tulikuwa tuna wasanii wa shule kila Friday unaitwa form 4 wakanilipia my first video. Nikaingia shule nikapigwa shukrani.
Ngoje shule yako ilikuwa
ilinilipia kila kitu, audio, video.
Everywhere GBS.
Welcome back, viewer, to Chungu cha Jamii. Today we are talking about beyond awareness in breast cancer and how to support and take care of our women going through breast cancer. Send in your question, interact with us across all our social media networks. That's GBS TV Africa. Our SMS line is 21144. So before we went on a break, I'd ask a question. I'm really looking forward to that answer. My question is, do you have the version of like we have for the menstrual stimulant for now the breast, so that men are able to feel and walk the journey at least kidogo, even for some minutes?
Unfortunately, we are not yet there, but I hope I hope we can get there, because when they actually understand what it entails, it will be easier for them to offer the support that their women need. Yeah.
I wish I was a scientist on that level. I could have worked on it soonest possible, the 3D version, and expose our men to it, so that by the end of the day we have actual the support that we need. Because I always feel like if the men are exposed, yes, they already know. Even supporting, they'll do it willingly without being coerced to do or forced to do. Anyway, moving on. Now, we've already taught us how to check on the lumps, what to do, and even how to walk into the facilities. Now let us move on to the next level. So once you have been diagnosed with breast cancer, what am I supposed to do next? What is the journey? Now take us through the journey of someone who is coming into the hospital, has already been done the examination. Now the results are out and are positive. How long do we wait for the results? If it is the mastectomy x-ray you're talking about, is it the only one that tells us that one is positive with cancer or negative? Two, the other examining things that you're saying that you check, because at some time you find you have lumps, but you're told they're not cancerous.
They're not cancerous, exactly.
Yes, so how do you get to know this is cancerous, this is not cancerous? And now, if it is cancerous, how now should we start our journey? Because everything has changed. It's, I'm normal me, yes, but I'm also abnormal me. So what are these changes? What are the mental phrases that you might say as a medical practitioner you've seen women go through? So that by the end of the day, we are able to help our viewer understand if this person is in this stage, this and this, they're experiencing this, so that even me as someone who is here to support, I'm able to know how to help, one. Two, if I'm the one who is having the disease, then I'm also able to know how to ask for help and also how to take care of myself. Please take us through.
Thank you for that question. So diagnosis starts at the simple level of a mass was found during either self-examination or the healthcare practitioner found a mass. So depending on how old you are, if you are under 40, normally we'll send you for the ultrasound, because in the younger patient, the breast tissue is still dense, so the mammogram will not detect well. But then if you're over 40, it's less dense and we'll send you for the mammogram. It comes positive for a suspicious mass. As you've said, not all masses are cancerous. In fact, most of them are benign, what we call non-cancerous, and they come because of hormonal changes. So if it is a suspicious mass that the radiographer or radiologist suspect it's cancerous, then from there, we'll send you to a surgeon. A general surgeon is a specialist who actually deals with breasts when it comes to medicine. So this specialist will order for a biopsy. A biopsy is when the tissue of the mass is actually taken and it is seen under the microscope, so that they can assure that these are actually cells of cancer. So the surgeon is the one who will take. So the biopsy, they take a small chunk of the tissue, the mass, so that they go and do histology, is what we call they examine it under the microscope, and then now the results will come. From there, from the cells, you can able to tell what type of breast cancer it is, because we have many types, and treatment will depend on the type. Now I won't go into that because that's too technical. From there, on top of that, we'll also do other scans like an MRI or a CT scan, because you can have breast cancer that is just localized in just the breast, but it can also spread. So it can spread to the lungs, the spinal cord, it can spread to the brain, it can spread to the liver, the adjacent tissues, what we call metastasis. So that scan will help us to know whether it has spread, because you know when it comes to cancer, we usually call it staging. So according to how much it has spread, we will stage the cancer. Okay? Most of the time we actually, in facilities that are well off, you just do a PET scan. You just scan the whole body and know where the cancer cells have spread. So after that, on top of that, even when the histology is done, there's things we do like hormonal testing, because breast cancer is different. Others are responsive to hormonal therapy, others are not. That's very important because it will tailor your treatment. Now, once we've done all that, we're able to say, now you have this type of breast cancer, it is this stage of disease, and now we can forward it to the oncologists who can start treatment. So from there now is where women will start chemotherapy according to the type of cancer. You'll undergo multiple cycles. Chemotherapy itself has a lot of side effects, as we know. So, of course, that is also a lot. On top of that, sometimes, you know, cancer is treated by many people. On top of the oncologist, you also have the surgeon. So in case it's a mass that they can remove, let's say the mass is just localized in one breast, then you'll go for the surgery that we call a mastectomy. It can either be partial or total, where they can remove the mass, and then either they remove part of the breast or they remove all of the breasts. And then on top of that now, usually you start with the mastectomy, then you do neoadjuvant, where now you top it with the chemo, and then you do radiotherapy. And then now, after all that, now is when now we say, once you have been cured of the cancer, now we can start talking about reconstructive or breast replacement. So the journey is quite long. It's not as simple as it seems.
Wow. Just listening to it, you can already tell the kind of mental breakdown that these people are facing. Now, what would you say that the workplace what roles should a workplace play in the life of a woman who is going through breast cancer? You were employed, you just learned that you have it, and now, you know, when it comes to terminal illnesses or long-term illnesses, depending with the stage again, like you've said, it determines, are they going to retain you at work, or are they going to release you? Now, could you take us through such a scenario, because how we could help our workplaces to be able to embrace the women with breast cancer? Because now I'm looking at it in two ways. One, the person who has been diagnosed with breast cancer is really not ready to tell it to the workmates because of the fear of losing the job. And yet again, you can't keep quiet because you'll be missing work oftenly.
Yes.
So where am I as a patient? What am I supposed to do? How am I supposed to overcome such?
So workplace support is very important. What I would want to say, it's very important that at work, when a woman is diagnosed with breast cancer, the first thing is, when she should be given paid leave when she's going on treatment. Because essentially no one chooses to have breast cancer.
True.
Yeah, and you actually need treatment.
Question, as you continue to answer that one doesn't give the leverage of not continuing. You said the woman is supposed to be paid leave, right? For example, when you're talking about maternity leave, they're given 3 months. That's automatic. Then after 3 months, you come back to work. If you choose to prolong your stay after maternity, it's on you. It's not on the company, because the policy doesn't give you beyond 3 months. Now, when it comes to breast cancer or any other cancer, maybe, but here today, having that you're talking about breast cancer, it doesn't have a time limit.
It doesn't.
Right? It doesn't say you're only going for treatments for 3 months, then you'll be back. It doesn't say for 6 years. It doesn't say for 1 year. Even that is why we're even having issues with even insurance policy taking cancer patients in cover.
Exactly.
Because it is not stipulated for this duration. The only thing now they're able to do is give limits when it comes to funds. You're not given unlimited access when it comes to treatment of the cancer using the insurance covers, different insurance cover. Now, how do you tell me as an employer to take care of my employee who has just told me, she has just told me that she's ailing from it, and they don't have an actual time frame?
As I said, no one chooses the diagnosis.
True, no one chooses, but this is work.
Yes, it's work.
If you're going to miss for more than 3 months, you have to replace you either way.
Yeah.
How do you strike a balance so that I'm not unfair to my employee, and you're also, you as an employee, you're not, no, you as an employer, you're not unfair to me as an employee or the company?
For someone who is undergoing active treatment, the employer should be able to understand that this person will actually need time off work so that in case they get better, they can actually come back. So that is one point of view of it. And actually, as an employer, the law protects your employee when they are sick and they need to be on leave for treatment. Yes.
True.
Yeah.
I don't dispute. But for how long? My question is, for how long do I have to endure this?
Thing is, these are things when you are an employer, you should be prepared for. Yes.
Even the insurance policy one is not prepared, and they are used to, this is what they are covering.
They are not, but that is the nature of human beings. We get sick, people die, you know. So when you are employing, you should be able to know that if your employer gets sick, the law protects them. So you should also have something to cover that. Because it could be you, it could be someone else.
True.
Yeah. We understand it's a lot from the employer's side, but actually this is just there. Everyone has a right to good health, and everyone has a right to employment. So, yeah.
Well answered. Now, as an employee, your workmates or your colleagues, how should we treat you? Because also with different people, different temperaments, there are those who will be comfortable letting everyone know that they are ailing for the support purpose of it, like you've said. We also look at it from the perspective of, I don't want people to look down on me because I'm sick. I'm able to take care of myself. I'm a big girl. I'm also looking at it from the perspective of the stigmatization and the fear that you've already talked about.
Yeah.
But right now, at the workplace, you know, am I even looking at the stigma per se? But rather, you're not even given the actual work you're supposed to do.
Yeah.
Like
you are viewed differently.
Reduced workload. Everything is like, it's like you are disabled and you're not disabled.
Exactly, I understand.
Because there's those people who really feel offended, especially if you take pity on them because they are sick. It makes them worse. Even you as a doctor, you always encourage us, usimsikilie huruma sana, let the person be, so that they are able to overcome.
So this is why it's very important for us to have open talks about things like breast cancer. So when we have, even at workplace, when people are educated, when we are spreading awareness as healthcare workers, we go above and beyond to also spread in other corporate spaces, other workplaces, so that these conversations can be open. People can actually understand what is breast cancer, what causes it, what puts you at risk, what is going on, what a person is going through when they're on treatment. So that's the first step that will help overcome stigma. The other thing at the workplace is building that support community for the person that is suffering breast cancer. So simple things like accompanying them for their chemo sessions to see what's going on. Let's just make it friendly and not put that barrier between us and the sick patient, showing up for them. Yeah, even organizing meals, praying together. These are things that actually help, because you get to feel what is actually going on with the person that is suffering the diagnosis. So
who gets to choose the circle? Is it the patient or the people around her?
It's good. At work, you don't really choose your circle. They are there, they're your colleagues. So when they just, when the colleagues understand and then they come together for you, it's good. Instead of now you on your own. I don't know whether you understand. Yeah. So that's how actually we can improve the workplace environment and ensure support at the workplace. Yes.
Interesting. As we talk about how to take care of our women and also support them, we can't live here without looking at it from the perspective of faith-based community. When you talk about faith-based, we are talking about churches, temples, mosques, name it, depending what is your faith. The first faith-based community, how involved would you say currently they are when it comes to supporting women with breast cancer, especially in Kenya? Because, I mean, this is the time you need your faith more strong as an anchor than ever before.
I would say that, yes, we see the churches supporting women undergoing breast cancer, but I don't have good knowledge of how actually they come into play with the things, especially like survivor groups or support groups. It will be very nice for the patient to get this at church level. Let's say at church level you have a support group or a survivor group where women who actually have had cancer, they come together to encourage the others who are going through their journey. It will be very nice from that faith point of view. Yeah. So at church level, yes, the support is there in terms of making sure we give the emotional support to our women, visiting them and accompanying them and praying for them. But it will be better if we actually have these support groups and survivor groups at church level. Yeah.
I want us to take a break. And when we come back, maybe we can look at it from how does media and influencers use the how do we use our platforms to make sure we create and prioritize awareness when it comes to breast cancer? Media, when I say we, I'm talking on behalf of media people and also the content creators, because they're also using social media platforms to create awareness. So when we come back, we can look at it and then we can look at conclusions of the matter, how now to take care of ourselves, and also to shake the dust and step on it, for lack of better words, so that by the end of the day, we are not drained per se when it comes to breast cancer. Viewer, I hope you're learning as much as I am. Send in your question, interact with us across all our social media networks. That's GBS TV Africa. Our SMS line is 21144.
Hello, my name is Nyabio. I'm from Mahanim. Call this school a good school because the second my mom saw it, she saw it was Christian-based. And when I see Christian-based, that's what the character my mother wants for me. And I like the sports that we play for PE. Like sometimes we play table tennis, we can play football, we match, and on Fridays we have games. And we verse the teachers in football. And this is why I think the school is the best school your children can go to.
Hello, kids. Did you know a year has 31,557,600 seconds? Why do you think so? Exactly. There are 60 seconds in a minute, 60 minutes in an hour, 24 hours in a day, and 365 and 25 days in a year. We count the extra 0.25 because of leap years. When you multiply all those numbers together, you get a huge number of seconds. That's why a year feels long, but time still flies when you are having fun.
everywhere. GBS.
Welcome back, viewer, to Chungu cha Jamii. Today we're talking about beyond awareness, and we're looking at how to support women with breast cancer. Send in your question, interact with us across all our social media networks. That's GBS TV Africa. Our SMS line is 21144. So before we went on a break, I'd ask a question on how do we people in the media and also influencers use our platform to create awareness for breast cancer per se.
So social media at our times right now is a very powerful tool when it comes to spreading awareness. It's very easy to spread awareness through social media as opposed to going from place to place, because it captures in the masses. So it's very important, like now that we're in October Awareness Week, our influencers can play a very important role in spreading awareness by posting messages that educate people about breast cancer. What is breast cancer? What are the signs and symptoms? About how to do self-examination, what facilities to visit, and where to get help. It's very, very important. So, you know, the people who are actually on social media, when it comes from an influencer, it's very relatable. Or when it comes to a platform like TikTok, Instagram, it's very relatable to them, because these people actually also speak their language. So you can see how important it is for us to spread awareness through social media. And the important thing is to spread the right message as opposed to spreading misconceptions and myths. Yeah, so that way a lot of people, the masses, will capture the message. And we have seen many patients coming in saying that they heard this from someone's post, or they saw this from a certain social media post, and they were actually, they were made aware and they were encouraged to come. So that's very important. When you also see an influencer going in for a test, or taking the examination, doing it herself or doing it at the hospital, it becomes relatable at the normal people's point of stand of view, so they will actually come. So that's how very powerful social media is during current times.
Interesting. Before we wind up, maybe we can look at the preventions. What are the ways that we are able to prevent? Because we mostly say prevention is better than cure. So what are the ways we look out for to prevent breast cancer?
So with breast cancer, I had not touched on this, but with risk factors, that when it comes to breast cancers, the risk factors, we usually divide them into two broad categories. We have the modifiable and non-modifiable. Let me start with the non-modifiable, so that when you go to the modifiable, that's where the prevention comes in. So the non-modifiable risk factors are like family history. That one you can't do anything about it. Or aging, you can't do anything about it. There is what we call early menstruation or early menarche, when your menstruation starts too early and your menopause ends too late, so you're exposed to hormones for a prolonged period of time. Those are things you can't really change. Or nulliparity, maybe as a woman you're not able to get children. So those are the things we call non-modifiable risk factors. There's absolutely nothing you can change about it. But now when we move on to the modifiable risk factors, which are very significant when it comes to breast cancer, you actually have control. Things like alcohol. When you limit your alcohol, you're reducing your risk for breast cancer significantly. For cigarette, you just say avoid, because cigarette will expose you to all and any kind of cancer and other disease. So just avoid. This is something you're in control of. Yes. So for things like, for women also, when you get children, we encourage breastfeeding. because you see when you're breastfeeding, you're getting an ovulatory break. So that way, you're not being exposed to the hormones for long. So we encourage breastfeeding. Breastfeed your children. That is actually something that can also act as a preventive risk factor. The other thing is exercise. Be active, do exercise, let your body be active, and keep a healthy weight so that you're not obese. Those are things we are absolutely in control of.
I have a question.
Yeah.
This one has just been triggered in my mind. You've said for prevention measures, avoid alcohol, and also, avoid cigarette, and if you have to do alcohol, low consumption.
Yes, yes.
For cigarettes, we can't say much about it because even the warning is given, it causes cancer. But now, studies shows that we can take weed as part of chemotherapy. How true is it? And we've had it, personally I've had it like it's for science proven. But what is the quantity and what are the measures that we are looking out for? Because as you know, in our country today, cannabis is illegal. But yet again, if you say it's legal, what is the content that is legalized? And for that one that is legalized, how often can I smoke?
Actually, for, let me use the medical or scientific name, cannabis. When it comes to in the healthcare, we use it, it's called medicated cannabis. We use it mostly for the pain rather than for treatment. So, and as doctors, pain is something very significant. So if you are in pain, we won't deny you something that is actually calming the pain. So for medicated cannabis is used for pain because the cancer is painful, the chemotherapy is painful.
So cannabis, it's a painkiller too?
Yeah, that is what we are using it for. But now for treatment, there is a lot of research going on. We still haven't found it as treatment, but it has many benefits. That is, research is still ongoing, but as for now, we are using it for pain.
For pain?
Because this is, for some time you find a patient has stage 4, it has metastasized. It's something that you can't actually cure, so they are going to be living with the diagnosis.
I have a question on that.
Yeah.
Given that you're employed, depending with the, let's look at it from a teacher perspective, a lawyer, you know, there are those corporate workplace that cannabis is a no-go zone.
Yes.
Right? But yet again, you've been given medication of cannabis. Do you write a note saying that this patient is allowed? So that by the end of the day, even there is no askari who is going to arrest, because people are getting arrested even for growing cannabis and even using cannabis, right? But right now, this is a patient who has been legalized, allowed to use it. How do they go about it, and how are they exempted from the law and everything that pertains of it, so that you're not told because you're not misusing it, you're given it, it's given to you as medication
purpose. So that's a very good question. In Kenya, we've not gotten to the point where we are actually using it. So in other countries where it's legalized for medical purposes, mostly the patients you'll find being put on it are the ones at hospice.
Meaning? The
ones that are receiving end-of-life treatment. Yeah, so they're just relaxing, they're at the hospice. So this is just something to keep them comfortable. But obviously, if you're someone who is still going to work, there are many types of analgesics or painkillers that you can use that will not interfere with others or interfere brain function. Yeah. I hope that's well understood.
Very well understood. I'm being told we're running out of time, but kuna swali moja nyeti. It has been asked. What happens? You've said about breastfeeding for a woman. What happens if kama hana mtoto?
Actually, when I mentioned the non-modifiable risk factors, I said that kutokuwa na mtoto is one of the things that put you at risk. So kama hauna mtoto, obviously you can't breastfeed. Na pia hiyo kutokuwa tu na mtoto pia inakuweka at risk. And most of the time it's not your doing. So really. But for breastfeeding, I'm looking at women who actually have children and they can actually breastfeed. Yeah.
Whoever is asking that question is very evil.
I hope ameelewa.
No, hajaelewa. Kuna certain way anataka ijibiwe. But moving on, maybe you can give us your parting shot.
So my parting shot is early detection saves lives. October is Breast Cancer Awareness Month. Come to our facility at Equity Afya Lucky Summer. This whole month, we are actually offering free screening services. So we come, you'll get the free services, you'll be screened for free. If we find something suspicious, then we'll send you for an ultrasound. We have those services. If you need a mammogram, we'll send you appropriately. We also have a surgeon on site. If you need a consult for your breasts, we have that. So it goes beyond awareness. Come and actually get screened, and beyond that, get diagnosed, because it is the action that actually saves lives. That's my parting shot.
Thank you so much, Hannah, for coming and honoring our invite and giving us more insight on beyond awareness on breast cancer issue. Viewer, I hope you've learned as much as I have. Let's continue this conversation offline across all our social media networks. That's GBS TV Africa. Our SMS line is 21144. Till next time, have a nice time. Goodbye.
Everywhere, GBS.